if we can moderate stress by taking a longer term approach. I always talk about these days, what's the 50-foot view like? What's the long game like? And a lot of people are looking for the quick wins, but those quick wins end up as like long-term losses.
Welcome back to another episode of the Smarter Not Harder podcast, where we give you 1 cent solutions to $64,000 questions. And I'm so excited to have on the show today, Dr. Mark Cheng. Mark is a friend, he's a colleague, and he's just a wealth of information. And I was so excited to bring him on the podcast to just share his wisdom with all of you. I'm super excited to introduce him. So he has a master's and doctoral degree in Chinese medicine and acupuncture. He also taught Chinese manual therapeutics at two of the strongest Chinese medicine colleges in Los Angeles. He is a martial arts expert in multiple different types of martial arts. He's made regular efforts to study with top Chinese style manual therapists, Western therapists, and strength training experts, including kettlebells as well, to gain a wider understanding of the human body and the safest, most efficient ways of helping it perform at higher levels with less pain and dysfunction. He has his own successful private practice based out of Diamond Bar in California, where he lives now. He does speaking engagements, he does workshops, he does seminars internationally, and he's constantly working on producing better instructional resources for people that love what he does, which is so many people. And Mark is just, again, a wealth of information. We had a great conversation here about all the various aspects of how he trains people, how he thinks about movement. We talked about slow movement. We talked about fundamentals with movement and foundational movement. We also talked about the parasympathetic and sympathetic balance and how he works on this with his patients. He sees anyone from elite athletes to soccer moms and everybody in between. And we really had a great time just talking about his philosophy. Mark is just a fantastic human, and the way he thinks about problems and the way he thinks about helping people is such an interesting perspective for all of us to learn as clinicians and for people that are interested in just getting better ourselves. We talked about how people typically fail when they start a movement practice. We talked about conditioning. We talked about strength. We talked about performance, and we talked about so much more. I really hope you enjoyed this episode with Dr. Mark Cheng. If you do, don't forget to like and subscribe below so you never miss an episode of the Smarter Not Harder podcast. Thanks so much for listening. Enjoy. All right, Dr. Mark Cheng, how are you today?
Good, sir. Good to see you again.
It's such a pleasure to have you on the Smarter Not Harder podcast. I've been actually really excited about this for a long time. And Mark, you're one of the people that I've known now for not that long. I met you during the pandemic, and I remember I was in a random call room in a hospital. I was working as a hospitalist in California at the time, and we were supposed to have a conversation for 30 minutes about hyperbaric therapy. And an hour and a half later, I looked at my watch, which I still had at the time. I was like, what the fuck just happened? I just spent an hour and a half on the phone with this guy that I've never met, who reached out almost blindly to talk about hyperbaric therapy. And you gave me all of these ideas that I'm still putting in practice today with my company and how things have evolved over the last several years. With that backdrop, Mark, I just wanted to ask you an open question, and then we can roll from there, is that if somebody asks you, Dr. Mark Cheng, what do you do for a living? What do you do on this planet? Like, how do you respond to that question?
What I do for a living and what I do on the planet are two kind of different things.
Okay.
There is certainly some overlap, but I think what I do for a living, in a nutshell, my doctorate's in Chinese medicine with a specialization in Chinese manual medicine. As a clinician, for that of what I do, I work on trying to help people feel better, especially people that come in with injuries or chronic pain. And a lot of these people, I've been fortunate. Some of the people that I've been fortunate to work with are professional, everyone from professional athletes to like execs, stay-at-home moms, whatever. And dealing with a lot of these high performers, I've gotten the pleasure over the years to also collaborate with and study under people like Gray Cook and Pavel Tsatsouline. Gray Cook is the founder of the functional movement system, or functional movement screen, which he created, and was really one of the guys that turned my clinical understanding on its ear and helped redefine both the sports performance field as well as physical therapy. So Gray has been instrumental in changing my mindset on things. And part of what he's done is help me really understand that and he and Pavel Tsatsouline both have done. For those of your listeners who are not familiar with Pavel, he's the gentleman who's responsible for basically bringing kettlebell training or Russian style kettlebell training to the United States, establishing a curriculum, and then is responsible for the popularization of kettlebells as a tool in the gym. So because of both Pavel and Gray, I got to appreciate how important strength training is for improving clinical outcomes. So because of them, I switched my clinical perspective and my view of myself in terms of clinical practice from I need to just treat people to get them better to sometimes I need to train them and get them stronger so that
Mm,
their bodies are moving more efficiently or more intelligently and with less liability so that they are not pushing themselves or driving themselves into pain, either with training or with daily life.
got it.
I always say I either treat or train depending on how my patient shows up that day.
I love that. And so when you're talking about movement practices, talk me through what are the, so you talked about functional movement, you talked about kettlebells. These are very different types of training, I would imagine. I've heard you talk a lot about slow movement and slow training as well. So my question to you, Mark, is that you're obviously schooled in lots of different types of movement. And you said you talked about Pavel, and I think you're one of the first people trained in the United States in kettlebells. Is that right?
Among the early group. Yeah.
Yeah.
I
And when
got I
was
got
this?
my
This is
instructor certification back in '06. So
right.
yeah, I've been out and about and traveling the world to teach either kettlebell intro courses or kettlebell instructor certification courses since '07, '08. So
Yeah, a
it's
long
been a
time.
minute.
Yeah. Yeah. One thing on the movement side that I've heard you talk a lot about is slow movement, how a lot of people want to go fast very quickly. What do you typically say? What's your framework there when you're thinking about movement? I'm sure it's very individualized depending on the person, but how does slow movement and what is slow movement to you really mean?
Slow movement is a demonstration or kind of a metric to me as far as what your nervous system is able to access. So, as our colleague, Dr. Jimmy Yuen, has said, slow is a speed. And I feel like if you're driving, I shouldn't say I feel like, this is just simple fact. If you drive a car and you're only able to go fast, like you're either in park or you're flooring it, you're
Mhm.
probably not a very good driver, to put it
Yeah.
very mildly. Similarly, if you can only move at a higher rate of speed when you're exercising or doing something like that you think of as athletic, like tennis players, for example, don't only sprint all out. Sometimes they move a little bit softly, sometimes they move a little bit leisurely. They don't floor it every single time, nor do people on the soccer field, nor do people on the football field. So certainly in basketball, people sometimes, if it's time for a layup for free throws, people aren't out there sprinting back and forth.
Right.
So the ideal human performer to me needs to be able to have access to that entire spectrum of movement. So just like a dimmer switch, right? Like ideally, if you have control of the dimmer switch, it's not just simply an issue of on or off. You have access to all of the ranges of brightness in between or darkness in
Mm.
between.
Mhm.
So for us as human beings, as far as movement, as far as expressing our strength, as far as how we manifest different behaviors, we should ideally have control of the entirety of that range. And even better, a wider and wider range.
So continuing to widen that range over time is one of the goals then.
Yes, continuing to widen that range with control and access to everything in between.
So if you have somebody that is new to movement practice. They're
Hmm.
new there and they're looking for longevity, let's call it. Let's not say like a specific goal. Because I think a lot of people that listen to our podcast now are like they listen to people like Peter Attia and others that are talking about longevity. Like you have to do these kinds of exercises that you can do the Olympics when you're 100 doing these exercises or something like that. That's just one framework that he uses and he's gotten some traction there. Do you have a framework that you would typically have people fall into or certain sort of methods of movement that you feel like are the most functional for people that are across the spectrum of that continue to allow us to like to stay as functionally optimal as we can as we get older?
I think there are certain prerequisites, like
Okay.
fundamentals. For example, if again to go back to that tennis analogy, right? No matter
Mm,
how good you are at tennis, no matter what level of being a pro you are, you're still going to work on your ground strokes, your volleys, your serve, right? Those basics, they're going to stay in play. They're still going to stay like something that you know that these things are perishable skills. If I don't stay on top of it, if I don't continue to hone them, like there may be like a degradation in terms of my ability to call on them under duress. Similarly, like I think there are certain fundamental or primitive movements that I think we all need to still have access to. Range of motion in the hips, depending on which framework you want to. Some people would say open chain versus closed chain, but are we upright? Are we crawling? Are we on our backs? Any different relationship to the ground or gravity we should still be able to access as full a range of motion as possible. So if it takes me holding 135 or something like that just to be able to flex my hips and my knees to get down so that my calves and my hamstrings are touching, maybe I don't own those ranges of motion. And maybe I need the weight to compress me to get down. And so I can rent my way into those ranges of motion.
I
But
see.
what level of ownership do you have is something to me that is much more salient question.
So let's talk about that. So
Mm.
can you dive into the level of ownership there? What do you mean exactly?
So if to me you wanted to own a range of motion in a
Okay.
joint, right? Can you do it loaded, unloaded, fast, slow, with momentum, absent momentum, against resistance, no resistance? And if the answer to any of those is no, maybe spending time in that area where the answer is a no is something that's going to help you get better control or better performance out of that. But these are things too that, to be honest, like a lot of people, especially high performers, they want to work on exercises that they feel comfortable with and doing things that they feel are fun or rewarding or exciting. And sometimes taking care of the prereqs may not be the sexiest thing to do, but there's payoffs down the line. To use an educational analogy, like the kid that petitioned his way into an upper division class in college may be able to get into the class, but they're going to struggle to be able to understand the material if they didn't fulfill all the prereqs. Now, the kids that did all the prereqs took their time and are working their way through that and did all the reading, going up into that upper division class, they'll be able to not only absorb more, but learn with a lot less stress. So I think in our lives, if you look at quality of life issues, a lot of those come
Mhm.
back down to stress. If we can moderate stress by taking a longer term approach, I always talk about these days, what's the 50-foot view like? What's the long game like? And a lot of people are looking for the quick wins, but those quick wins end up as like long-term losses. And so if you can play the game such as you're calibrating those quick wins on a much smaller scale so that they add up to longer term wins, you'll have a much more successful game, a much more rewarding life.
I love that. It's hard to, the American way is not slow and steady, right? It's very Western culture focused. Your training is in Eastern culture and Eastern philosophy and martial arts. I mean,
Sort of. Like I was born and raised here in the States, so
yeah.
it's a tough thing. I actually had a whole podcast that I was recording with a friend this weekend on what it means to be Asian American.
Okay.
And I think as an Asian, we have the privilege of having access to all of these thousands of years of knowledge and culture. But
Mhm.
as an American, we have the freedom of recombining stuff and then accelerating that, amplifying that.
Yeah.
I think while Western culture is definitely impatient, some of that impatience is a good thing because it's a driver of change and evolution.
Sure. Sure. Sure.
Um, but yeah, having the ability to shift gears, though, that's the thing. And again, that comes back to what we were talking about earlier. If you can shift gears and then go down into a lower gear and then go a little slower and be a little bit more diligent about the process, about understanding, admiring, becoming aware of, and respecting the process and honoring the process, then there isn't that impatience and there's usually more completeness in terms of ownership, of understanding.
Yeah. One thing I always find helpful for people that are listening that are learning about you or about me for the first time is talking about when we failed, talking about when things did not go the way we wanted with a particular client, for example, or even a family member, and how that sort of spurred on learning, education, your development. Do you have anything like that that you can think of that really, it sounds like you had a big shift with Pavel and with other movement practices. Pardon the interruption. This episode is brought to you by Transcriptions, makers of precision dose, pharmaceutical grade, and physician formulated formulas in the form of a buccal troche. For this episode, check out Tromune. This is our cordyceps extract, cordycepin, which is 100 times more potent as an immune system activator, as an anti infective, as it's something that's going to increase your deep sleep. Go to transcriptions.com and save 10% on your order by using code POD10 at checkout. Now back to the show. A long time ago. Was that because you had something else that didn't work out the way you anticipated it, or was it just an evolution or anything like that that would be interesting to share?
It's a little bit of both. I think, again, I gotta, when it comes to clinical evolution and when it comes to people that I think help me grow a lot as a medical professional, and certainly as a fitness professional or a human performance professional, the hat tip always goes back to Gray Cook. And Gray, for all of his accomplishments and all of his understanding, is someone that really emphasizes humility and accountability. And so his whole thing is like measure on the front end, try your intervention, measure on the back end. And like you've got to constantly be taking and retaking quote unquote pulse of the patient or the client all the time because you don't know whether or not what you're doing is working because you don't know necessarily if the person that's showing up from one moment to the next is exactly that same person. Like
Mm-hmm.
they may be exactly the same person in terms of their ID, but in terms of their neurology, maybe their biochemistry, maybe how their energy is, maybe how their serum glucose is, maybe how whatever their mindset is. They're changing from moment to moment. So if
Right.
you are not open-minded in your approach, if you're not like keeping track of who and what you're dealing with, then you're missing part of the picture. And so that the way that he brought that to my attention through metrics such as the functional movement screen, which is called the FMS, or the selective functional movement assessment, which is the medical version of the FMS, SFMA, those things, those tools, I think really just gave me a great means to be able to measure and say, okay, wow, this is what you're coming in with. Let's try an intervention. Let's remeasure. And based on the remeasurement of movement capability, then we see, okay, that was an effective or useful intervention, or was it not?
Mm-hmm.
So as far as vignettes when I failed, gosh, in clinic, there are so many times when people have come in, like their referrals, back when I used to have my clinic in Santa Monica. There were times when people would come in as a referral, like one of my patients, let's say, had a great result with, I don't know, migraines or lower back pain or what have you, right? And then they tell their friend, and then their friend who has a similar issue comes in, describes it to me, and as I'm listening, the differential diagnosis is telling me that, wait, the etiology of this, everything leading up to their, let's say, their migraine is different, totally different animal, right?
Right.
There's no history of trauma. There's nothing going on as far as when I palpate. Like I don't feel like there's something going on in terms of upper cervical disturbance. Maybe this is not something that lends itself to treatment via the modalities that I have at my disposal. There are times I think when not so much failure, but just being clear on when to refer out.
Yeah. Knowing your lane and knowing when you have the capacity to help somebody. And I think that's a big thing that a lot of clinicians don't really understand when they're first starting. They want to be able to help everybody when it's unlikely that's going to be the case because you're going to have people that are just going to be outside of your expertise, especially when you're getting started. So I find that's a big thing for me too. And I find that like a lot of people that will come to me for hyperbaric therapy, for example, and they tell me that they have like migraine headaches. But,
Hmm.
oh, by the way, I got into a severe car accident and I was in the ICU for 3 months and now I have chronic headaches. So there's probably something physical going on there, no doubt about it. But
Hmm.
there probably is something significant additionally that needs to be addressed from a mental psychosocial perspective for them to see significant benefit because of the trauma related to all of that. So I've
100%.
become, yeah, and I think I've told you this, I've gotten in trouble before because I tell people not to get into hyperbaric chambers as opposed to getting into them because I find that there's a lot of pre-work that has to be done. And I'm sure you find that similar in the kinds of work that you do.
Sure. I think with every model, this is the longer that I'm in medicine, the more I find this to be true. There's absolutely no designation, MDO, DPT, whatever, right? DC, there, LAC. There's zero style of medicine that I found that cures it all.
Right.
Not a single one. Like nothing has nobody's batting 1,000, not even close.
I heard about your
Um,
finger though. I heard you have a finger that bats 1,000. I was listening to a podcast.
Oh man, yeah, it's so funny when I'm sure you know this as someone who's a manual medicine practitioner as well, right? Sometimes when you press those areas on a patient that they're not necessarily aware that particular area is hypertonic, is
Sure,
like
sure.
super tight or triggered, right? And then when you press that spot that they're not expecting to feel pain in, and all of a sudden they scream and you're not even pressing there that hard, it's a very aha moment for the patient.
Yes, yes, I
Um,
know. Yeah. Yeah.
yeah, so
I was listening to that when I was like, that comes with a lot of practice, like a lot of experience to be able to use manual therapy, which you do in a very intentional, very acute sort of way to show somebody what is actually happening with their system. But anyway, I didn't mean to derail you, but just to say that I thought it was hysterical that you press this guy's shoulder and all of a sudden he was screaming like a baby.
he's a tough dude too, I gotta say. That was a funny moment.
Yeah, yeah.
Funny moment.
Yeah. Yeah, I think that as we get further in practice, all of us know that none of us have all the answers. And so I think that's why it's important to have a network of people around you that you can refer to, that you can talk about with questions. And I can call you, Mark, and say, hey, Mark, I don't know about doing this person. Or you can call me, like, I don't know how this person probably needs you, but I don't really know how, or whatever it might be. And that's what you create over time, not only your own expertise, but you also create the network of people that can support your expertise and really help patients in the end.
Truly, the longer that I'm in practice, the longer that I'm working as a professional, the more grateful I am for the people that I have that I can call on as colleagues, because especially people like yourself or Dr. Jason Hahn or Jim Yuen or Gray Cook or Pavel Tsulin or whomever, right? These
Right.
people who I can cross-reference with and say, hey, I'm dealing with this. Can I have your insights? Or folks that may say something that I totally don't
Right.
expect, right? Maybe someone who's very strong in terms of manual may say, hey, have you checked what their labs are like? Are they deficient in this or that? And it's, oh, I didn't even think about that. I was thinking more from a structural standpoint. So these different perspectives are just, it's like having access to a gold mine.
Yeah. Yeah. I think that I know that on the individual side, the terminology or the phrases like your network is your net worth or something like that. I don't know
Hmm.
what the equivalent is on the practitioner side, but I truly feel like it is worth its weight in gold to have, a great network. And this is something that the people that are listening, if you're clinicians, like this is not something that you build overnight. This takes many years and a lot of time getting involved in your community, understanding what you think you need to help support what you're doing. So this is not something that just happens overnight for most people. I think you would agree with that.
Sure, and it takes a lot of humility too. Just simply, like, I think a lot of newer clinicians are so eager to show that, yo, I've got my stuff together. I
Yeah.
know what to do. I know how to, like, I'm cool and I'm capable. But I think sometimes if we can just tone that down enough to be like, I don't want to be complacent. I want to learn. I want to be humble enough to figure out how to serve, or how can I be better at what I'm doing, and how can I learn from whomever, right? Whether
Yeah.
yourself or Dr. Chad Waterbury or whomever, right?
Right.
These folks that are somewhere in the game, that have an insight or have some sort of like thing that you want to be able to address them in such a way where, like, how can I have the privilege of learning more about these things? And sometimes they may be like, okay, hey, like, I have these articles online, please give these a read, and give those a read. If someone tells you that, instead of thinking like, man, like they just blew me off, maybe they just directed you to a treasure trove, and it's, you can
Yeah.
now look through that on your own time at your own leisure and digest that, and then come back to them with questions.
Yeah, I think that's great. I think, and I like to try to remind new clinicians the same framework. You have to just be open to learning. You have to be open to being wrong. You have to open to expand your horizons of what you think is part of the solution and what you didn't think what was part of the solution. But to be more focused on your practice a little bit here is that I want to talk about a couple of things. The first one I was thinking about was you work with a lot of people. You said soccer moms to high performance. Overall, like in your experience, like where do people mostly fail at their goals as far as like their process? What's your sense of that? Is it getting started? Is it getting moved? Is it somewhere in the middle, like in having expectations that are not appropriate for what they want to do? Or where do you see like people mostly failing when you're working with people? I'll repeat the question. No problem. So can you hear me, Mark? Am I
Oh, there we
back?
go again. Okay, here
Am I
we are.
back? Okay.
Yep,
Okay. No
you're back.
problem. Okay. I'll just make a note. Okay. So my question to you, Mark, is that you work with a lot of people from soccer moms to elite athletes and everybody in between. Where do you see most people failing along the process? Is it something that is in the beginning when they're first getting started? Is it their expectations are too high? Where do you see them usually going off the rails and not being able to do what they want to do?
It can be a little of anything. It really just depends on the individual. Some individuals are just like, they're too, for example, people that want to, quote unquote, want to get in shape after having been relatively inactive for a while, right?
Mm-hmm.
Sometimes they're feeling like, okay, for me to be able to do X, Y, and Z exercise, I have to get in shape first. And I think that's the failure of fitness professional, whatever fitness professionals they may or may not have access to, in terms of helping them understand that these are the things that you will do to get in shape safely and sustainably, rather than pushing that go hard or go home, sweat is fat, crying, or whatever, all of these kinds of things that folks put out. And I get it. Most of them are very well intentioned,
Mm-hmm.
but not always accurate. So I think there are some folks that get derailed because never quite get on the rails, and they're trying
Mhm.
to go 1 foot on and 1 foot still out the door rather than being committed. And a lot of that, like I'm saying, is the failure or the failure of whatever fitness professional or wellness professional or training professional they're working with to give them a pathway, give them the right stepping stones so that they can succeed. Some folks, on the other hand, are a little bit too intense and their issues are quite the opposite. So some of them may go off the rails because they're just pushing too
Mm.
hard in a direction that may not be the most productive for them. A lot of high achievers know how to push themselves into discomfort, and discomfort is fine at a certain point, but sometimes it's not the discomfort that you like. Maybe they're focusing on the wrong discomfort. So in other
Mm.
words,
Mhm.
maybe they're training in such a way where, okay, my legs and my glutes and my this and my that are all fried. Okay, that's wonderful. You're training into physical discomfort because you're trying to push the envelope as far as the volume that your body's able to endure. However, have you dealt with the discomfort of having to be patient and working on other aspects of your movement potential or movement inventory that you may not have such great access to? You may be wonderful in terms of pushing however much weight in your squat or pulling in your deadlift or doing X number of box jumps or double unders or running however long, but are you also able to do the mobility work where you're doing Cossacks or you're doing yoga or you're doing whatever kind of fine motor control work? Or are you working on the half kneeling progressions that you need to? Or are you doing the foam rolling? And most folks are like paying lip service to those things that they've been sweeping under the rug. And if these folks were as disciplined about those things that they were sweeping under the rug as they are with their favorite exercises, then they would stay on the rails or they'd actually have a much smoother, faster, more successful, more sustainable ride than otherwise. So, yeah, it really
Mhm.
depends.
Mhm.
From individual
Yeah.
to individual, it depends.
Yeah. It's like when I was a kid and skipping leg day at the gym. So nobody wanted to do legs because you just wanted to have big chest and muscles in your biceps. But like your legs are important for the rest of your body to have some sort of balance. So if you
Sure.
go directly to sprinting to the bigger things without looking at the smaller things, I think that's common across the board. I appreciate your comment earlier on the Asian American heritage and the ability from a Western perspective to make stuff bigger, better, and awesome because you can do things that you wouldn't be able to do in like a slower culture, as it were, like an Eastern philosophy. But I think that
Right.
also gets us in trouble as Americans because we want those results 10 days ago or 10 weeks ago when we need to like slowly, like I had a guy just yesterday, and actually the interesting question for you is he's running the Leadville race. This is a race here in Colorado, and
Okay.
I think it's about 100 miles or so.
Wow.
So it's a long race. Yeah. And so he's telling me that he was having severe issues. Like he wants to get his PR, right? And he wants to like have the best, form possible. I'm like, dude, it's 2 weeks ago, 2 weeks away. I can't help you with anything. So if you want to do it next year, we can talk about it. But if you had somebody like that and they were doing 5Ks, you can't just get them up to 100K right away. Like if they do, they're going to die.
Gray has a great line about that. Gray talks about it as if you really want me to tune the car, you have to put it in park and maybe turn the engine off for a moment. So a lot of folks are like, hey, I want to still be able to floor it. And as I'm flooring it, you do X, Y, and Z because I'll idle for 5 minutes. But
Yeah, yeah.
I'm not going to put the car in park for any sustainable amount of time. I'm not going to let the engine cool down. Like you just have to work some magic. And unfortunately, the reality check at that point is going to happen for them. Like they may be able to find someone that is going to write a check, so to speak, on their tissue quality.
Pardon the interruption. This episode is brought to you by Health Optimization Medicine and Practice Association, a nonprofit organization training practitioners how to optimize health rather than treat disease. For this episode, check out the metabolomics module. Metabolomics is foundational biochemistry. Understanding how your body and how your cells work is so important as clinicians and so is important as patients. If you're interested in learning metabolomics, go to homehope.org and save 10% on this module by using code podcast10 at checkout. Now back to the show.
Or on their adrenal
Right.
glands or what have you.
Yeah.
Get a little bit more out of them in a super unsustainable fashion. The piper always gets paid, dude. So
Yeah, totally. Yeah.
we have to, I think the tough thing is we as clinicians have an obligation to give people that momentary come to Jesus talk as far as you can do certain things. It's possible for you to do certain things, but there will be a consequence
Yeah.
and you may not like that consequence.
Yeah, I'm just thinking about a couple of people in my history here that I've worked with, some of these elite athletes that were at the top of their game. But at least from
Hmm.
my perspective, looking at some of their laboratory analysis, it looked like they were about to die. They're not like literally, but their ability to make energy was so poor, their detoxification status was so poor, and they were just on this edge, right? It's like having a conversation with some of these guys, because like you said, you can compensate when you're younger, but there's a certain point where that's just not possible anymore. Right.
Certainly.
Yeah.
One of my colleagues in Canada, Dr. Bernard Onarquash, had a great line, and he said, "You can give the best clinical interventions, you can give the best corrective exercises, you can give the best supplements, you can give the best whatever. But if the patient comes in and they really need like a smoothie, a hug, and a nap, like all of the stuff that you try and throw at them it's not gonna stick. Why? Because you're like on a biochemical level, this person is just trashed. And so the nervous system isn't uptaking new information. The tissue quality is probably dehydrated or whatever, right?
Right.
You're
Right.
not operating on an ideal platform. And then this person's probably swimming in cortisol at the same time. So now what do we have going on a metabolic level? Throwing ideal type things to fine tune someone on it's if you want to fine tune a performance vehicle and the vehicle is in the shop, the engine's turned off. You can take the time to run that kind of analysis, and you can also do those kinds of interventions. Great,
Right.
but if the car is already like the radiator's already melted down, and then the tires are flat, and this, that, and the other, that there's a process that needs to be honored.
Yeah. Most of our patients are on all the time. They just want to keep going and going. What are some tricks that you found that can really help people? Obviously, having the conversation that at some point they're going to break down is necessary, but many people won't listen to that directly unless they have
Mhm.
some sort of experience with, oh shit, now I can't do what I wanted to do because I have an injury or something like that. But what are some of the tricks that you found that help people slow down, that help people get into that neutral or go into park or idle at least? Have you found any specific ways? I'm sure it's very individual, but I'm sure there's some themes here that have worked over the years that really help your patients. What I would say is, for lack of a better term, calm the fuck down.
Yeah, so in those sorts of situations, usually what I tell my patients, especially those that are higher performers, like especially pro athletes, Olympians, what have you, right? Fighters, dude, give me a week or 2 weeks. That's all I ask. Usually just like 1 week.
Okay.
But if you really want to feel a dramatic difference in terms of how you feel, in terms of how you perform and how you recover, like I want metrics from the front end, whether those are biometrics from something like a Whoop or an Aura Ring, what have you. But I want to see metrics because I want to be able to throw those numbers back in your face. And this sounds dickish, but this is reality. I want to have a receipt so I can go, this is what you thought was working for you. This is what I asked you to do. And if you honored the process, I can see that you honored the process, but now look at how much better the results are. So because of that, that before and after, usually that's the way that I, for lack of a better term, shame people into compliance. People that know how to get a lot out of themselves, get a lot in terms of improving their performance by pushing hard and only by pushing hard. I go, homie, what if you just pushed in this particular area that you haven't yet pushed in before? And then
Yeah.
trust me on this, come back in 1 week and then Florida as much as you want on the court, in the ring, however, and just see how your body feels. You tell
Yeah.
me. You be the person to tell me. And if I'm wrong, cool. You've only sacrificed a week and you can feel free to give me walking papers. Because if I'm wrong, then I want to own up to it. First and foremost, like I don't get anything when something I do wrong is swept under the rug. I want to be able to face it so then I can improve as a professional and certainly as a human being. But if they honor the process that I lay out, and 99 out of 100 times when my patient or my client is honoring the process, they go, okay, Chang, you're right. Who
Yeah.
knew?
Yeah, shocking. So what does that week look like? What are you having them do typically? So if say it's a fighter or like an elite athlete, and you're
Hmm.
like, you need to give me a week, and I'm going to show you these before and afters of your aura rings and other metrics that I'm going to show you. What are some of those metrics that you use other than the aura? And then what are you having them do for that week or two when you're trying to reset them?
So more often than not, it's like I need to see where they first. This is where the metrics like the FMS, the functional movement
Yeah.
screen, or the
Yep.
SFMA are so valuable, right? Because like when you can show someone, okay, these movements were painful or dysfunctional, like usually the dysfunctional ones hold the most aha, right?
Hmm.
So if you can show someone that where there was pain or where there was dysfunction in those two areas. The before is way different from the after, or the after, I should say, is way better than the before. Then you get adherence, you get compliance. And what I'm looking for is what areas are these people or is this particular individual deficient in that's usually dysfunctional, non-painful. In other words, what is it that you want to be able to do or you think you can do, but it isn't as coordinated as you imagined it is, you imagine yourself to be? And let's work on those skills so that in a non-threatening environment, in an environment where the stepping stones are close enough together that you can make progress without wondering whether or not you're going to fall into the pond.
Right.
So let's work on these areas of challenge, for lack of a better term, so that they don't challenge you anymore, so that you own them. And then let's revisit after you've worked on those prerequisites so that you can see that now other things that used to be painful or challenging are now neither of those. And so now when you go back to sport, or now when you go back to whatever it is that you want to do, and all of a sudden those things, those previous issues don't hurt, then it seems, wow, I was doing stuff that had nothing to do with my sport, and all of a sudden I can do my sport better. And those moments, those are the real, wow, holy shit. Maybe Doc Cheng knows what he's talking about.
Yeah, look, I'm sure you've had this happen long enough to know what this kind of cadence is going to be for people, but certainly they're coming to see you now because they know you can make those shifts pretty quickly. And I guess this comes back to what we were talking about earlier, which is like the fundamentals, right? You're going back to the fundamental aspects of movement that are going to help them no matter what they're doing. And of course, focusing on some of the places where they have deficiencies or some pain, but I would imagine a lot of this has to go back to fundamentals.
It does. It really does. Like a lot of folks are very good at chasing higher level skill. And certainly like a lot of the athletes I get to work with have superb sports specific coaches that I will
Right.
never in a zillion years be able to compete with. I'll never be that level of a shot put coach. I'll never be that level of a boxing coach. I'll never be that level of a basketball coach. Just if I was, then I'd be in those fields. However, as a clinician, looking at the stuff that they're not addressing and being able to focus efforts on that while improving performance in their chosen field, I think that's where we get the most cred, the most street
Yeah.
cred.
Totally. But you're also not stepping on anybody's toes, right? You're not like trying to tell them how to do their sport better, which I think is really big when you're working with an athlete and they have a team and there's a lot of investment in that team for that athlete and vice versa, or coaches on various types of professional sports. They don't like their players getting training on other types of ways of doing the sport. But when it comes to fundamentals and range of motion and movements, like on the basic foundational side, like that's not touching anybody's toes. They're only making their job easier, I would think.
Even as a strength coach, even as a strength and conditioning professional, like I often say to
Yeah.
athletes who have their own strength and conditioning coaches, they're like, dude, don't look at this as I'm giving you a whole new strength and conditioning program. I'm not. Like, you want to do whatever strength and conditioning exercise you do, wonderful. My only ask is if there's something that hurts, please don't do it for now. You can
Right.
go back to it later, but for now, let's bench that exercise or idea or that thing temporarily. And because people look forward to getting back to that for whatever their reasons are, then they don't feel as threatened when I say that sort of stuff. So if they know that their pet lift or their pet exercise or their time-honored traditional whatever training method isn't being stolen from them or taken from them, they usually don't feel so threatened and they're a little bit more compliant.
Yeah. A couple of various things I want to ask you here. So one of the questions, maybe it's an easy one, would be, what is your favorite type of athlete to typically work with? Do you have a specific sport that you've had the most fun with over the years? Is it just vary on the individual?
It really very God, and that just as I'm thinking back
Yeah.
to even like the last 2 weeks, just the folks that I've had the privilege of seeing here, who are more like family friends, as well as folks that I've had to see on location. Man, it's such a varied bag,
I had a
and
feeling. Yeah.
I'm really spoiled in the sense that now I say no more a lot than I say yes, way a lot more. So the folks that I get to work with are folks that I genuinely dig. So I feel like I get to do work that I love with people I love, and then to be able to be paid what I get paid for it is just, I'm blessed out of my mind.
Yeah, I love that. So when it comes to strength and conditioning, let's
Yeah,
go there a little because I love to
sure.
understand more what you do on that side. Other than I've known more like about your Chinese medicine practice
Hmm.
and your movement practice and sort of like the rehabilitation. I have some questions still on there too, but because I think the bigger arching question that I wanted to get to after this was around pain, both acute pain and chronic pain, because I
Hmm.
know they're very different, but almost everybody has some of that all of the time,
Yeah.
either one or the other. So when it comes to strength and conditioning, it sounds like you're obviously a lot about kettlebells and you've used that practice a lot. Like, what are your main ways that you talked about strengthening for movement, strengthening for power? Let's talk a little bit about strength and how you talk to your clients about it and how you work with them on doing it, on building it.
Okay. So as far as kettlebells go, that just happened to be my point of entry
Yes,
into
exactly. Yeah.
weight training.
Yeah.
Pavel Tsutsoulian, my mentor, is quite fond of saying that it's not about the kettlebell, it's about the movement. And it's about the principle of movement, whether we're using a straight bar, like an Ole bar, or whether we're using fixed access machinery, whether we're using dumbbells, whether we're using kettlebells, whether we're using whatever we've got access to, lifting stones, whatever the things may be, right? It's about the principles of training and the methodologies that we're using and the guiding logic more so than the tool. For example, one of the things that I say to some of my patients who, parents, they have to take care of their kids, and so oftentimes lifting their kids. Every time you lift your kid, that can be an opportunity to rehabilitate an exercise, believe it or
Yeah.
not,
Yeah.
if you use a particular method. One of my taglines is make every rep rehabilitative. You still there?
I lost you there for a second. So you're saying every time you can go back to saying what you're talking about every time you're doing something, that's when I lost you. Yeah.
Okay. So every time a parent, let's say, picks up their kid or carries their kid or carries their groceries, right? Every time we do those do those movements or perform those tasks, those are actually opportunities to rehabilitate as well and build strength if we know how to do it in a way that's safe and that is rehabilitative. So if we've got to do stuff, why not do it in a way that serves more than one end at the same time?
I'm with you. Yeah, and so let's drive that further, right? Because I certainly know from my experience, this is actually probably how I injured my back after having four kids and not realizing that I was not doing anything functionally correct at all until one day I tried to touch my toes, and then the rest is history. When it comes to strength, you think about different types of strength. You think of like core strength, you think of strength of your biceps or your quads. Like, where do you think core strength falls into all of this? Is it always it's always the first and primary, or is it something that is not always as necessary to start off with?
I think core strength is a nebulous concept for most folks, right? A lot of
Okay.
folks think of core strength as like their abdomen, their abs, their midsection, rather than the small intrinsic muscles in the spine, the muscles of respiration, the pelvic floor, the groin muscles, even. So a lot of these folks don't really understand or don't really envision as part of the core. And so, like, people go, oh, okay, then all you have to do is just breathe and your core is activated, but
Ab
not really.
exercises. Yeah.
Um,
Okay. Gotcha. Yeah. Or
yeah.
just do
So
ab exercise or something. Yes.
and it's not nearly that reductionistic. Like there's so much that goes into really training the core. And I think people also might want to think about how to access the core rather than as something to be focused on so intensely. If you're training a whole bunch of other exercises that are full body exercises, the midsection, those muscles will fire anyway, right? So
Right.
it's, if you do a max, even like a preacher's curl, where your arms are supported and you're trying to curl a weight on a fixed axis, where you're supported, and it looks like a rather isolation type exercise. If you're using a considerable weight, and I guarantee you have an EKG that's hooked up to your abdominal muscles, I guarantee you those are firing too. As far as which order should we work on things, I would say like most people in general, especially adults, would, and not just adults, at this stage in terms of history and American history, I would say even adolescents, because most kids are becoming more sedentary
Mhm.
earlier on in age. Working more and more range of motion with coordination and control. What are the exercises or what are the things that we can do? I would say this is probably the clutch question. What are the things that we can do to train ourselves how to get better control or exhibit better control and do tasks through different ranges of motion, in different ranges of motion, or in different postures without pain and with facility? Like to be able to run and throw is great, right? But to be able to crawl and throw or be able to, I don't know, even swim and throw, these are all different tasks. So, like a water polo player is very different from, let's say, a basketball or handball player. And the more different venues, so to speak, in which we can test ourselves, test our abilities of this particular task, let's say throwing, I think those are the things that are going to get us more longevity and better performance in the long run.
So if you had a baseball player, for example, would you do those kinds of things? Would you change the way he was throwing in different, like in different sort of venues like that? If you use the example of throwing a ball, or is that more just like an example of an overarching understanding of that we want to have more flexibility in all of our joints and ranges?
I think it's more an overarching thing because let's say
Yeah,
if I have a
yeah,
baseball player, I'm thinking just from my own personal experience recently. The baseball players that I've dealt with are ones that are overtrained in a particular movement or overusing a particular movement. So
yeah.
the thing that I need to help them with, the ones that I've dealt with more recently, is helping them understand where muscles might be hypertonic. And so allowing them the stimulus to know these muscles are hypertonic. How do
Mm-hmm.
you relax them so that there is now flow? There is elasticity
Mm-hmm.
rather than trying to drive around with the parking brake stuck on.
Gotcha.
Um,
Interesting. Yeah.
and so that's the first step. And then a lot of times getting their bodies to understand how unilaterally they've been moving
Mm-hmm.
rather than bilaterally. And
Mm-hmm.
so when you look at a sport that drives you really well in one direction, that's awesome. But not playing that sport, like you're walking around or you're carrying groceries, you're doing whatever with your kid, like real life isn't quite so as bilateral, or I'm sorry, isn't quite so dramatically unilateral as a given sport like golf, for example.
Makes sense. So when you, one thing that I've asked you questions about over the years, and I have really a lot of respect for you, is understanding chronic pain, because I know you do talk and work with people that have, chronic pain on a decent clip and been doing this for a long time. Chronic pain is an issue, right? It's not a small amount of the US or probably the world population that have some element of chronic pain. When it comes to chronic musculoskeletal pain specifically, like back pain, joint pain, when you first start approaching chronic pain in somebody, you have a lot of tools in your toolbox. I know, Mark, and a lot of it probably depends on the person. But what is your typical framework here when you're thinking about somebody and you're trying to start working on their chronic pain that they've had for 5, 10 years and they've seen 10 doctors and you're the last doctor they're going to see, and et cetera, et cetera. I know you get cases like this, and certainly I have all the time too. And I refer them out to people like you. And so you have that person comes in. What's your framework there? And how do you think about it?
Really, it starts with an assessment. Like I've got to be able to find out what's at the root of what's at the root of this pain. So for example, lower back pain. That lower
Yeah.
back pain could be secondary to something tight in their hip, something tight in their quad, something like not firing right in terms of the back of their leg. Maybe there's some part of the calf that's locked up, or some part of the ankle that has been historically weak, and therefore other muscles up the kinetic chain aren't firing properly. It
Right.
could be that there's lower back pain because there's like some sort of disturbance or misalignment, like structurally in terms of vertebral misalignment. It could be lower back pain because there's a space occupying lesion, like they have a history of a fracture or there may be some sort of tumor there, right? So because there are all of these different possible causes, like the assessment is clutch. And some of these things may be lifestyle oriented, like you may be able to get someone completely free and clear of their pain or of their problem and their lifestyle, their ergonomics, whatever it is they do, it's immediately going to jump them back into that problem. Until you can identify and address those underlying issues, we're just throwing spaghetti at the wall and seeing what sticks. Like everything to me starts with that intake, that assessment. Tell me about the history of what's going on. Tell me in detail, and then let's assess. Let's find out what's really driving this problem, or as close to what's really driving this problem, and then work our way back to health.
Yeah. I mean, I think you've had this experience. I certainly have, where somebody comes in with severe back pain and they have imaging and it looks like they have a little bit of something going on, but it's not dramatic. And then you have somebody comes in with no pain. They're just coming in for performance or something. But they have an MRI of their back and it looks 100 times worse and they have zero pain. And you go, what's going on here? I would imagine that a lot of the questions that you've asked, or you ask your patients, are ones that have never been asked to your patients before.
Yeah, it's funny that you say that. Yeah, absolutely. And in fact, I get accused of that quite often. Like, how come none of my other doctors have ever asked me this?
Yeah.
Or how come my other doctors haven't suggested this or that? And it's like, how come my doctor doesn't know this stuff? And to be honest, we're all educated in our particular lanes, right? If you ask me how to do an emergency surgery to remove a bullet from a patient, I'd be like, dude, you're at the wrong place, wrong. No, like
You
I
have some
just don't.
acupuncture
That's not
needles. I
my
don't know if
thing.
that's going to work. Yeah.
Um,
Yeah.
and yeah, that, and then some soft tissue work and maybe some rock tape. No, and as good as certain herbs are in terms of aiding coagulation, I think a massive bleed like that. No, you need to get you to an
Yeah.
ER.
Please. Yes.
Yeah.
Local hospital. Yes.
But said, there are still a lot of things that I think we as multidisciplinary professionals who may have a specialization of our own, we are all under the umbrella of medicine. And that umbrella of medicine, or that medicine, is under the umbrella of human performance, right? Like we should be doing medicine to be able to improve how the body performs, not
Mhm.
just looking at human performance as a title that's reserved for Olympians and such.
Absolutely. Yeah.
That goes back to what you were saying as far as like having a great network or developing a great network from which you can learn from, be inspired, gain different perspectives.
And always keep learning. And that's the thing. I think that resting on your knowledge is only going to get you so far. It's eventually going to catch up with you, is what I always tell people as well, that you always got to keep learning. One of the things I wanted to ask you about too was on sort of the meditation breathwork side of things. What is your
Mm.
take on meditation in general? Do you have any particular ways that you teach your clients meditation or breathwork, or what are you doing on that side of things?
So funny that you asked that because I just posted something about this on my socials, on my
Oh,
Insta. I think a lot of people use meditation almost as if, almost like a drug or almost like a means of escape. Whereas meditation should be more about like how well you tune into your reality, how well you become more aware of what's going on in the reality of your given situation, right? And understanding how to embrace that reality and navigate your way through that reality, that to me is meditation. And being
mm,
able to relax into rather than resist your reality is part and parcel of meditation. But I think a lot of people conceive of meditation in the sense of, oh, I'm going to go meditate and then escape my problems or escape my stresses for the day. Whereas I think the best meditation is what allows you to stop fighting the stressors or fighting the stimuli of your day so that those stressors become, rather than distressing, they become eustresses. In other words, stressors or stimuli that allow your body to get better.
I love that, because I think what you're talking about there with meditation is like the spiritual ego side of things. Like, oh, I
Hmm.
meditate and I have this meditative state that I go to, and then it makes me a better person as a result of that. But then when they have their kids that yell because their TV changed channels, and then they start yelling back at them that they should be watching TV or whatever, like they're reacting all the time. But oh, I just need to go meditate and calm down. Like it can be helpful, but like the idea is that your life should hypothetically be a meditation, right? It should be having the ability to, like you said, be present in the moment and have the ability to be responding rather than reacting. And I have one of my colleagues, his name's Dr. Ted. He has this
Mm,
phrase that I like a lot. What he says is like happiness is like the basic, like you completely and utterly are okay in the moment that you are in right now, because that's
yeah.
all that you have, and no matter what that moment is, because
Hmm.
that's all you have, right? But you get to choose how you feel in that moment. Nobody else can feel it for you, but that takes practice, of course, especially if you have chronic pain or you have 4 kids like I do that are yelling at you and trying to come in during the podcast, whatever it might be, because they have been. But that's okay. But I agree with you. And do you see this as also similar with breath work as well, or is breath work more different in the sense of, I know you're working on that on the strength and conditioning and the movement side as well, but oftentimes they're lumped together. So just wondering your take on breath work as well.
So breath work to me is absolutely crucial. Like Chinese martial arts and Chinese physical culture actually devotes an entire span of practice or of understanding to it called qi gong. Qi literally can take the meaning of like internal energy, or it can mean breath or air. Gong meaning exercises or skill. So it's like one of the most fundamental translations of qi gong is literally breath exercise. So if you can't control your breath, you're leaving a whole lot on the table when it comes to being able to alter your biochemistry.
Hmm.
Change your breathing. Let's look at it this way. You want to know the quickest way to alter your blood pH? Change your breathing pattern. A lot of people are like, oh, change my blood pH. I gotta take alkaline water and this and that and the other, and I got to eat these kale. And you could do that, but the digestion process will still take some time. How you breathe, whether you slow your breathing down or you hyperventilate, can dramatically change your blood pH. To me, if you can change your biochemistry that quickly through something that is instantly under your conscious control, why not? Like, why not devote some time to learning that skill and understanding the importance of it? And so, to me, if we can access those kinds of breathing exercises and understand, how I thought I was breathing in terms of I'm breathing good enough. Like to the average person who doesn't have a background in optimization, they
Mm-hmm.
have no idea what they're leaving on the table. So they think, oh yeah, yeah, as long as I'm not like having an asthma attack or in pain or passing out, I breathe just fine. Whereas if you look at higher performers, such as some of the special operations groups, regardless of what country you're looking in around the world, most of these guys, most of these operators are doing exercises that are qigong essentially. So why? Oh, is it because they want to become suddenly like these mystic masters? No, because that's a direct point of entry, a direct door that you can go through to improve your human performance and recovery. So
Mm-hmm.
breath work to me is one of those things that if you want to know how to recover faster, if you want to know how to manage your stress, if you want to know how to access sleep. So actually, this is a funny thing. One of my patients who's like, when they came to me, crazy insomniac, they're like, yeah, on a good night of sleep, I get 4 hours. And I'm like, dude, do you nap during the day? No, no, I don't need to nap. I just keep going and it's four
Mm-hmm.
hours. And I'm like, wow, that's insane. And but they're a stress case,
Of course.
very stressed out. And
Yep.
so simply having that patient working on very deliberate breathing patterns and then taking the time to become familiarized with not only the exercise of the breath, but then also audit the physical sensations that are happening while working on those was such a major aha that it switched them from sympathetic nervous system dominant to parasympathetic nervous system dominant. And then
Wow.
suddenly they're able to knock out and then get great napping. And then also over time, use those same exercises prior to going to sleep and then sleep. I remember the first night that patient did those exercises. He reported back to me. He texted me and was like super excited to have gotten 6 hours of good sleep
That's
and
a big
woken
deal.
up. Yeah, it's huge.
Yeah.
Yeah.
Do you have any, what are the easy access points for people that are listening as far as if they want to, start a breathwork practice that can, Qigong is, I have a great memory. My father is a chiropractor, I think, and
Yeah.
he's in New York and he had this Qigong provider. He was this 5'2" white dude that was the buffest, like the strongest guy, like not like huge, but like he always had his shirt off and he was just all muscle. And he would
Hmm.
do all these Qigong practices in the office. I just remember looking at him going, oh my God, this is amazing. And so I know that practitioners are just phenomenal. And what are the easy access points for people that are thinking about trying to start a breathwork practice? Do you have any recommendations?
Sure. For some folks, just especially if you're someone that like is dealing with chronic fatigue or inability to sleep, sometimes the easiest point of access is lie down in your bed. Get yourself so that you're not having to support yourself. Allow yourself to scan for what kind of tensions or discomforts are in your body, and then just work on letting those go first. Just gradually, slowly unraveling them,
Mm-hmm.
little bit by little bit, and constantly pushing the envelope. And I got to underscore this: constantly pushing the envelope to say, can I unravel this a little bit more? And then
Mm-hmm.
while you're doing that, while you're scanning, and while you're developing that meditative awareness of your body, then on top of that, breathing in such a way where you have a longer exhale,
Right.
and that exhale becomes slower, softer, less forced, and then you take that into varying the speeds of inhalation and exhalation.
Yeah, that's beautiful. I love that. I always talk about this exactly with my patients too. I always usually start the body scanning is great too. I think it's a great way to do it. I think if I just have people start just with long exhales, really just trying to extend their exhale can go a long way to helping them calm down if they can do that 10 times. Mark, I've taken so much of your time and I could talk to you forever as about all the amazing things that you're doing all the time in this world. Oh, you can't hear me. You lost me.
The last thing I heard was, Mark, I've taken so much of your time.
Okay. I'll repeat that. I said, Mark, I've taken a lot
Thank
of
you.
your time today. And I really appreciate you spending some time with me and our audience here talking about some of your masteries and your skills and your recommendations and thoughts. My last question for you is like a global, probably sum up of our conversation, I would say. It's at the end of our conversation, all of our conversations, we ask our guests, what are the 3 ways that all of us can live smarter, not harder, as that's the name of our podcast. And what we try to do here is obviously not grind if we don't need to grind and trying to find ways to optimize. So what are 3 things that you think all of us could do to live smarter, not harder, Mark?
One, really embrace the concept or really embrace the possibility that there is something that you could do better, you could be smarter about. So for a lot of folks, not knowing where that is or not having a good idea of where that is, we grow a little bit too complacent. We think that, no, I'm doing this, whatever the this is, right? I'm doing this right. I'm doing this fine. I don't need to work on, for example, my breathing, right? Oh, I don't need to work on my breathing. I breathe just fine. I don't have asthma or anything. But being open to the possibility there's something that you could do better, I think is the first and foremost thing that we could do to make our lives better so that we can work smarter and not harder. 2, on top of that, in terms of the humility of acknowledging the potential and actively seeking out that potential, but that where that area is that we could improve on, then actually doing the legwork, actually trying to find out what can I do better in this area that may be deficient, and getting into the habit of auditing your own internal processes. So first, I always say when people ask me, what's the secret to your success? And I always feel like, one, I haven't really succeeded yet, so that's a work in progress. So for me, because I don't feel like I've yet succeeded, it doesn't mean I'm miserable. I'm quite enjoying the process, but I'm always looking for ways like, how can I do this better? What is there that I'm leaving on the table? That's driving my hunger. That's always keeping me curious. That's always keeping me rather easily inspired. And that's why I get so jazzed about the times that I get to vibe with you, because there's so many ideas that I get from you that it's like, oh, dude, like I got to try that. Whatever the modality is.
Right. Yeah.
And I think after those 2, the third thing I think that's probably the most important is just simply surrender or acceptance. Understanding that there will be failures, understanding that there will be times when you don't do things ideally, that you may not get the win, that you may not have the peaceful, quiet home, and that people may go to bed pissed off. And that's okay, because as long as you are trying and you try wholeheartedly, you've got to be able to be at peace. Like I think maybe before we started recording, I mentioned that like life for me these days, it's not just juggling. It's like swords of Damocles, right? Like, the mythical sword of Damocles, the king had one over his head. Like at any given moment, I have from 5 to 12, whether it's like my elderly parents who are living with me, whether it's my kids, whether it's work, whether it's training, whether it's rehabbing my own injuries, whether it's doing whatever the laundry list of things is, whether it's house repairs. We only have so much bandwidth. So until we get comfortable as individuals understanding that there will be L's and not all W's, if we can't handle a loss and know that it's not fatal, then we're going to be crippled. So understanding that part of being alive, part of being in the game means that not everything will be the perfect outcome all the time. I'm cool with it, and being able to accept that and just surrender to the process allows you, I think, the freedom to move better with more grace.
I love it. The first one was strive to be better, but at the same time, surrender to the fact that it's not always going to work out when you try, and being happy and being content in the moment at the same time as striving to improve it's a fine line for people, but I think it's so important that you describe that. That's such a big part of, I think, learning and growing. So thank you for that, Mark.
Yeah, Bruce Lee, I think, expressed it perfectly with a lot of people paraphrase the quote to absorb what is useful, reject what is useless. But really, it's a 4-part. Research your own experience. That's important, right? We've got to do the legwork. We've got to do the research. Then absorb what is useful, reject what is useless, add what is essentially, or sometimes I'll say uniquely your own. So that's a 4-part process. So like you're constantly in evolution, you're constantly growing, and you're able to prune the tree as needed on the fly.
Love it. Mark, thanks so much for being here and sharing your wealth of knowledge. If people want to learn more about you, what you're doing, where's the best place for them to find out more? Is it on Instagram?
The easiest place to get a hold of me and certainly to find out what I'm doing in real time is definitely Insta. And that's at Dr. Mark Cheng, DrMarkCheng.
Yeah. So Mark is a humble guy. He's worked with some of the most high level athletes, movie stars, and people around the LA area and around the world. So he's well respected and well loved. And even though he gives people a hard time and tells them to stop and do what they're doing and stop being stupid, but as we all do as clinicians in the most beautiful way possible. Mark, thanks so much for spending some time with me. And I hope I get to see you soon, man. It's too few times I get to see you. I really hope it's soon that we get to hang out again.
Amen to that, brother. I look forward to it as well. And thank you for inviting me onto the podcast. And I look forward to seeing you again soon as well.
Thanks so much for tuning in to another episode of the Smarter Not Harder podcast, where we give you 1 cent solutions to $64,000 questions. And Dr. Mark Cheng, he is just an amazing human. He has such a great philosophy and a presence and a way of working with people and just a mind that's just going in so many amazing directions. And I hope you guys just got a small little glimpse of that in this podcast. If you like this podcast, please don't forget to like and subscribe below. Please share with your friends and colleagues so other people can learn about the work that we're doing here at Smarter Not Harder and Transcriptions, and especially the guests that we bring on that bring such great information to all of you. See you next time.